Hi, everybody. Thank you so much for taking a few minutes out of your day to join me for my fellow pharmacists, pharmacy students, nurses, doctors, dental hygienists, everybody in the healthcare world. This video is for you and for everybody else as well. But I just wanted to come and introduce myself. For those of you who don't know me, my name is Dr. Alicia DiParalisa. I am a PharmD, so I have my doctorate of pharmacy, and I'm an independent consultant with Arbonne International. I'm also a member of Lambda Kappa Sigma, which is the first professional pharmacy fraternity for women in pharmacy, and our mission is to elevate women in pharmacy. So it's such a great organization. So a lot of you may be watching this because of that connection that I have with you. So, but today my intention really is to give you a presentation and give you a brief overview of a different way of looking at nutrition and products as a pharmacist, and how Arbonne's 30 Days to Healthy Living program works, why you should do it, why you would do it, who would benefit from it, what it entails, and then some food pearls or nerd alert things to help you and your body in the process of cleansing and healing. So hopefully you guys really like this. I want it to be like fully informational for you all. I will be reading from notes, so I do apologize if that bothers anybody. Hopefully not. And we will have a PowerPoint, so I'll be able to kind of show you that as well. So as pharmacists, right, we're trained as experts in prescription medications, symptom management, and adherence to those medications, and just how to take it properly. We become experts in what medications treat what we specialize in. Like, so there's cardiac, oncology, psych, HIV. I'm certified in HIV. And one of the most passionate disease states I look at is diabetes, which I have my certificate for that as well. But we don't really have, any intensive or extensive training in food and nutrition, right? I know studying for my certificate of diabetes with APHA, there was, a small portion of that. And it just wasn't what we really do need to know to understand for our patients, because, our patients aren't just taking pills, they're taking food as well, right? When I was on the bench too, there weren't many things that I really could, like, off the top of my head, talk about when it came to nutrition for my patients. I also teach, I'm an adjunct faculty at Mass College of Pharmacy in Boston, and part of the lab that we do, it's a community-based lab module. And when the patients, our patients, our pharmacy students are counseling, one of the points they have to hit on that rubric is non-P-call and lifestyle and nutrition changes and things like that. And, we grade on that. And if you don't hit those points, like, you're going down to the next grading part of the rubric, right? But in real life, do we really do that? And I'm going to say probably 90% of the time, we don't. We know with certain medications like Coumadin, for example, right? Like those leafy green vegetables with statins and grapefruit. So we have a few of those, and we always tell people, like, don't have fatty meals like McDonald's, right? Because it could slow down the absorption. And that's kind of, I think, where it truly does start and end almost. Obviously, this is a generalization. If you work in a grocery store pharmacy, you may be a little bit more on nutrition. You might have opportunities where you can work with your patient, with the nutritionist, with the pharmacist. But on the mainstay, I think, as pharmacists, we have a huge toolbox that we can treat patients and conditions, and understanding a little bit about nutrition and how it works along with personal care products is just a next thing that we could add to our toolbox to help patients. So for me, I'm not about counting calories, right? Or fad dieting. The word die is in the word diet. So why would you want to do that, right? In the past, I focused on diets for my patients and myself. I looked at the nutritional label, I looked at the calories, I looked at the carbs, I looked at sugars, right? Like, when we look at, just the back of a label, sorry if it's not coming through, right? We usually just look at the supplement or the nutrition facts here. We don't really look, I know it's hard to see with the lighting, guys, but we don't really look here. Those are ingredients. I know you can't see it, but we're not really looking fully at those ingredients, right? So when I was focusing on diets for patients, like that's what I paid attention to. What I didn't look at were those ingredients. Crazy, because as pharmacists, like, isn't the ingredients the things that we're known to be experts about, right? Active, inactive ingredients, and we're not really doing that. So now, alongside with pharmacy, I teach people about food and how it affects our health, positively or negatively, because we aren't plants, right? Like the last time I checked, we're not a plant. We don't photosynthesize. So we have to consume things from the outside world. A plant can just like do its own thing. We need some help, right? We're also omnivores, which means we have to consume a variety of things to make our vessels in our body work optimally. And a super awesome thing about being an omnivore, besides it sounding cool, is that we have a choice of what we're going to put in to make our vessel work optimally. But then the super challenging part about being an omnivore is that we have choice. And sometimes we put crappy choices in. So, and if you put garbage in, you're going to get garbage out, and that's going to affect everything. But when you set your body up with the right info, only health and vibrancy and joy can show up. And as pharmacists, that's what we need to be doing for our patients. It's not just the medications, it's everything. So for me, in came Arbonne, and that's where things started changing. It was around in 2015, I had heard about it. In 2016, I started utilizing some of the products. Now, a lot of this presentation is going to be hand in hand with the Arbonne products, because as a pharmacist, I am a nerd and I did a lot of my research. And honestly, guys, like this company was the company that just aligned with everything that I was looking for and how to help a patient, how to help myself. So, like I said, I was 50 pounds heavier and unhealthy a few years back. I was the person with the Red Bulls at work on the bench, right? Like we called it like palpitations, heart attack, and stroke. And depending on the day, that's what my technicians would ask. Like, hey, do you want the stroke one? Do you want the palpitations? Which is crazy because it can give you all that, right? Or then I would have sodas, or I'd have, lattes, or I'd have them go to Dunks. That's Dunkin' Donuts, and just get stuff. And then eating, right? Like you had not even 2 minutes to eat because those patients needed you. You couldn't use the restroom ever. So, again, you had to have things that you could just be able to fit into your busy life. So a former student and LKS sister introduced me to this nutritional lifestyle plan. And I was hooked, guys. I lost 50 pounds. I lost 17 in the first month. And then within 6 months, by following this program and really understanding what food was physically doing to my body, and then what products were doing to my body as well, I just started to flourish. I'd also never heard of network marketing in the past. And so I learned about this business model and I was pretty hooked. We know what we do as pharmacists, right? We go to school for like 6, 7, however long years, depending on what your specialty is. And then you go out into the pharmacy and you know what you're going to do pretty much every day, right? Like some jobs are really cool because it can be a little up in the air, but we know what we're doing. Network marketing was never something as a child I was like, I want to be a network marketer, right? Like nobody really grows up thinking that. And nobody is like, hey, let me sell some protein, right? Like that's not what we were doing. But when I understood the market was just word of mouth, that's like coming to the OTC, the consultation booth at a pharmacy, right? And asking, that's what they're doing. They're asking an opinion and you're sharing your opinion on products, whether it's a personal use, other patients have used it. So it was the same thing. So I totally understood how this business can work because it was, my friends, my family, and networks trusting what I was recommending, just like I do as a pharmacist. I learned more about these products. I was so impressed, not just about the philosophy and the commitment of pure, safe, and beneficial with this company, but how each product was consciously formulated to really add health to our busy lives. Every product, whether it's nutrition, whether it's skincare, whether it's makeup, whether it's hair care, whether it's the baby line, they are designed to work on our organs of elimination, to get rid of toxins, and then to help our bodies get healthier. And help wakes us up to what's really working for our body and what's not. I know after doing the 30 days what foods I can and cannot have. I know I don't really have any allergies to certain things, but I do know, like, if I eat soy, I might get a little cray cray because it's a hormone disruptor. right? Crazy. I also know that if I have too much dairy, I'll get this little thing I like to call Doris. Doris is my dairy zit. So if I have too much dairy, my skin will break out. And there are actually many things. You can just Google this, and you can see what a dairy face looks like, or wine, or gluten, and you can see imperfections of your body overworked by what you're eating. It's so, so crazy. When I tried the 30 days to healthy living in 2016, I was kind of skeptical, right? Many of you are probably thinking the same thing watching this. But I was not just the formulations about the whole thing and the cleansing mentality. Like, I don't have time for BMs on the bench. And if you don't know what a BM is, it's a bowel movement, but most of you are probably healthcare, so you know it. But many of us will hear the word cleanse or a cleansing diet, and we're like, oh my God, totally extremes, right? We're gonna be starving. We're just gonna be drinking like olive oil and cayenne pepper and like some lemon juice or something insane. That's not what this is. What I discovered with Arbonne was the philosophy around the 30 days is to do a few things. So now I'm gonna have the presentation come up. So give me one moment so I can share that with all of you. Let me see. I'm not like the most technical savvy of the bunch, but that's okay because you don't need to be. All right, where is, okay. Here we go. And here we go. Okay, great. Let me move my little face so it doesn't bug too many people. Hopefully it doesn't bug anybody. But okay, so here we go. We'll go into here. So we're going to be doing the overview, all of this jazz. Fabulous. Okay, so what we focus on with the Arbonne 30 Days to Healthy Living, excuse me, sorry about that, is whole food eating. So many of you, I'm sure, you can raise your hand if you're watching this in a group presentation, has heard of whole food, whole 30 or paleo diet, right? And what is that really meaning? It's meaning eating foods the way they were meant to be eaten, whether raw or cooked, but not adding like additives or preservatives or things like that. So you're taking a carrot and you're having a carrot. You're not taking a carrot and then like mixing it with a bunch of stuff, or you're not making a pizza and then throwing all these things that you, if you're a pharmacist, you can probably pronounce them, but if you're outside of the health word field, you might be reading it and being like, what is this, right? That's not what we're looking for. So we're looking at that whole foods, okay? The second thing that we do is avoiding foods that can cause inflammation. So we avoid inflammatory triggering foods and addictive foods. So what are those? That's gluten, dairy, soy, sugar, alcohol, caffeine. So during this 30 days to healthy living program, that is what we're eliminating. Now you don't have to do the Arbonne 30 days to healthy living. If you want to go like a whole 30 and go all your meals this way, like go for you. I just know as a mom, as a pharmacist, as a wife, I personally, I don't have the time to plan out 3 whole food meals a day, nor do I want to spend an entire Sunday food prepping. It's just, I did it when I was on maternity leave and that was it. So I don't love to do that. So that's where the 30 days that we'll talk about work so well, because you're able to have plan like 1 meal a day, which is way easier than 3, but you supplement the other 2 meals with our vegan protein. So we'll talk about that. But the big thing is avoiding those foods. So anybody that has a disorder or a disease that has itis, at the end of it, ITIS, that's inflammation, right? There are so many foods in actual products that we put on our skin that contribute to the inflammatory response, right? And having an inflammatory response, it's good, guys, right? That's what happens when like you cut yourself, the inflammatory response comes, triggers the white blood cells. Like we want that. The problem is these type of food, they continuously cause that. And when you continuously cause something to happen, it doesn't have time to rest and reset. So that inflammatory trigger continues. And then therefore the inflammation never gets actually fixed. So like with arthritis and things like that, gluten is a huge sensitivity, and dairy for things like that. So people who have, you know, any of the arthritis styles, like that's a big thing. Alcohol and sugar. Sugar is such a big thing when you think about not adding health. Now, sugar can be good, guys. There's a lot of people that will tell you do a 7 or a 10-day, like absolutely no sugar. Guys, that's not the right way, and it's not doing anything because you're going to bounce back. Your body and your brain, this little bad boy up here, totally needs sugar to function. but it needs the good kind of like real sugar, not like, the Domino brand of fake sugar. So a little bit of sugar is okay. We actually do need it. Your organs need it. Your brain needs it to be able to, send information down. So we are avoiding that excess sugar or sugars that are high glycemic index versus a low glycemic index. Anybody that is around the diabetes field, you guys know that we want to keep patients' blood sugars stable. We want to do this in everybody, but especially with diabetic patients. So if there is going to be a sugar, we want something that has a low glycemic index that will keep it there. But guys, think about all the diet sodas and things like that. One, it's artificial, so your body doesn't know what to do with it. And two, like those glycemic index, like they're going up and down, they're crashing. And why? Let's have a conversation with them and keep them from there. Okay, so moving on to the next slide. So the next thing, what we focus on is the importance of absorbing our food. So as Arbonne beautifully puts it, we are not what we eat, but what we absorb. How crazy is that? So when I talk about this with people, I look at, whether it's nutrition or skincare, you're going to absorb things through your gut or through your skin. So 60% of what you put on your skin is absorbed into your bloodstream and internal organs. So a really great example of this is, fentanyl patches or nicotine replacement patches, right? Like, obviously, if you're putting something onto your skin, that type of a product, right? That is going into the bloodstream to help administer either the pain or crave that nicotine. 200, that's the average amount of synthetic, not just regular chemicals, because water is a chemical, guys. The average American puts 200 synthetic chemicals on their self, and it's stored in their body. Synthetic, the body doesn't really know how to get rid of it, guys. It's synthetic. It doesn't recognize it because it wasn't what God gave you, or whoever you believe in. It's totally fine, but we're storing those chemicals just in our body, and they don't really know what to do. So you have to be able to introduce things that are going to help remove that for you. So what are we doing? We're providing products that help our organs let go of toxicity. So that's the lungs, that's the GI, that's the liver, that's the skin, that's the kidney. In my LKS days in school, I remember one of, she's a pharmacist now, Allie, she gave us the fun fact, the skin's the largest organ in your body, and it totally is, but it's also one of the large organs that gets rid of toxins. So think about, deodorant, right? And antiperspirants. We actually sell products in the pharmacy that are for people to not sweat, and that's for excessive sweating. But guys, skin and sweating is how to get rid of some of the toxins. So think about deodorant, right? I know it's in the news all the time. Everyone's looking for a clean deodorant that's aluminum free because aluminum will block that. That's just a deodorant, not an antiperspirant. Guess what? Arbonne has one, and it's really good, and it's shea butter, and I love it. Side note. But when we're putting that stuff there, we're keeping ourselves from sweating, and sweating's pretty good. It's your body telling you need to get rid of something. But if we're keeping that in there, guys, what's near here? It's lymph nodes. So if we're keeping toxins in, they're eventually going to seep into our lymph nodes. And for women especially, what's close to these lymph nodes? Guys, it's these right here, right? Think about breast cancer and all of the prevalence that we're seeing. So it's not just by foods that we're eating and things like that. It's not just, stuff in the ozone and things like that. It's just the normal personal care products that we're using. And it's so crazy because in the US, the FDA bans under 30 ingredients in our personal products that are shown to be harmful or potentially harmful or even causing cancer. Okay, so 30. Wow, Alicia, that's a lot. It is not 30. That is not a lot. So in Europe, the European Union bans about 1,500. So I think a lot of people know, Europe standards are nicer. They go out, they buy their food super fresh every single day, right? And then their products are just better because they don't allow that stuff. So 30 to 1,500 is a huge difference, right? Arbonne bans over 2,000. And they are now a certified B Corporation because many of their products are recyclable, or they work with TerraCycle, or they're compostable. So again, the things that we're utilizing with this company is so amazing. And if it's not Arbonne that you're using, it's totally cool. But just make sure you're looking for products that are going to kind of fit that silo of healthier, pure, safe, beneficial. And they are banning and putting your body, the planet, over profits. Because if you do that, you're going to get, you know, effectiveness, but you're also going to have safety, which is so amazing. And speaking of like the food and things like that, like think about when people ask like, oh, you know, with Whole Foods and things like that, like, oh yeah, like I grow my own veggies or I do this and I do that. That's awesome, guys. And like, good for you. I have deer, so like I could never grow anything. But if you're going to like the normal grocery store, you're getting the fruits and veggies before they're fully nurtured. I would say it's almost like, you know, a preemie, right? When a baby is born early, we're in fear that maybe not everything is where it needs to be. Same thing with food. And I know it's a very drastic thing, but I feel like just visually people get that. But when you go to the grocery store, right, the farm is going to pick the fruits and veggies, but they have to pick it before it's actually ripe. Because if they pick it when it's ripe, by the time it actually gets to the grocery store, they're going to be rotted. So they have to pick it way before it's ripe and allow it to ripen and get to nutrients where it's detached from its source of getting the nutrients. So that's why it is really hard, even when you're eating organic or non-GMO and things, you're still not getting the full nutrients, which is why you'll want to supplement with nutrients and minerals. So we'll talk about that, but just like food for thought in that. Okay. Now let me move this because I don't know if it's gonna, you don't fully need to see me, so that's fine. All right. So the next thing, like this is a bathtub, obviously you could see it. Could this be affecting your body? So we're going to use the analogy of the bathtub. This is something that a lot of medical professionals are kind of taught in medical school. So imagine that your body is a bathtub and the drains are the organs of elimination that we just listed. So the kidneys eliminate through the urine. We're going back to school right now, guys. The GI is through feces. The skin is through sweat. We discussed that. And the lungs are through breath. Like we want to take 100 conscious breaths a day. There's a reason for that. When you turn the faucet on, you're adding things into the bathtub, right? You're adding things like, but for the body, it's water, food, air, thoughts, mind-gut connection, guys, and the things that you're putting on your skin, okay? All this stuff that you're adding, your body has to like kind of figure out and sort through it. And then it's going to try to hold on to what it needs to build your body and then let go of what's not serving you, right? So let it go, like Elsa would say. We want to get rid of that stuff that's not serving your body to be as healthy as possible, okay? So the problem is though, let's say for, you know, sake of argument, we're going to make a sweeping generalization and say that most people's doors or drains or organs of elimination in Western society aren't functioning optimally, I can speak. And so what happens to the drains? So what's affecting our body, right? When the liver is overburdened, the body stores toxins in the safest place. And that's in your fat, adipose, so usually around the middle. So that's why when we're looking at patients and we're looking BMI and circumference, right, we're checking that space out in like this area, because the bigger that is, probably the more toxins. It's not just like fat that we're worried about, but that's what we think in the Western world, like it's more toxins, right? So when water's coming into the bathtub at a faster rate than it can drain out, it's going to overflow, right? And when toxins are entering the body at a faster rate than the body can handle, you're going to get sick. So eventually the toxic effect will spill over, affecting the whole body's system. So we need to clear the drain, right? So we're going to maximize our body's detoxification pathways. So again, the skin, kidney, liver, bowels, lungs, and skin. With this program, and a program that you may find, as long as you're doing it properly, it's going to offer products that are designed to mobilize and remove unwanted toxins. It's going to support the function of the liver. That's our T. It's going to restore a healthy digestive environment, and it's going to cleanse and open the skin. It's so amazing how it is. So what happens to those drains, right? I'm just going to go back to here. Yeah. You guys can look at this picture. So they're going to get clogged. Toxicity builds up. We experience symptoms like PMS, weight gain, headaches, migraines, osteopenia, joint pain, thinning of the nails, the hair, hormone imbalances, guys. Like the list goes on and on and on, because right, the top 200 drugs, top 400 drugs, top 500 drugs, 1,000 drugs, right? They're doing all these things, right? Because it's so rampant in our country. And if we keep doing what we're doing, we're going to keep getting what we're getting. So the toxicity by what we're eating or what we're putting onto our skin or what we're breathing into our air, right, into our lungs, it's going to keep building up and building up. And the body just isn't going to know what to do with it. So when the body doesn't want to put the toxins, right, the vital organs. So the body has the adipose tissues that we talked about, and that tries to take the toxins because we're trying to save the vital organs. But eventually, like the vital organs get overloaded because the toxins spill out like the bath drain. So it's just so crazy, right? So the body came up with a brilliant plan. It said, hey, let's create an inert place where we can keep the toxins away from the vital organs and keep them there, right? And that's adipose tissue. So that's that fat. Fat's like a bubble wrap for toxins. It's like, I'm going to keep you safe. But by doing that, I'm not going to keep you safe. So evolution of, obesity. So here's a little story I'm going to read. So don't mind me. I'm reading back and forth, guys. Thinking if we keep doing what we're doing, we're going to keep getting what we're getting, and the toxins and the fatty issues will keep building up, wreaking havoc on the endocrine system and eventually the vital organs. And we will most likely then end up with a diagnosis or a disease that we see all the time in our practice. So what do we do when we get caught in this? So like before Arbonne came into my life, I would just see that with patients, right? They're getting on one med and then they're on another med because of this side effect or that side effect. And then eventually they start having a ton of meds, right? Like nobody in the pharmacy is like, yes, that patient just got 10 scripts filled. Woo! Yeah, let's keep giving them stuff. Like now they have diabetes. Awesome. We're not doing that, guys, right? We don't want that for a patient. So what do? We like advise them like, here, like do this for the side effect. Maybe we can remove this because I think it's a side effect of that. And, we'll advise them to avoid certain foods, like little things like that, right? Like we talked about earlier with like, if you're on Coumadin or if you're on a statin, we do that, but we don't really know enough in our education for most of us, right, to actually go in. But then you're going to look at somebody, and if you're telling them like, oh, now that I know that these foods can cause these triggers, and you're going to tell, like, let's say a single mom, right, of 3, and you tell her to avoid gluten, dairy, soy, alcohol, caffeine, right? She's going to be like, that's so not possible. I can't do that, right? And they're not going to listen to you, right? They're just going to take another pill instead and not listen. So Arbonne and the information and the education you can learn from this program is a toolkit that you can go and say, hey, it's really simple. You can still have pizza, a healthier pizza, but I'm going to talk to you about how to look at food differently for 30 days, give your body time to heal, time to clear out the smoke in the room, right? And then when people do something like this and an elimination, they usually can find out like, oh, does cheese affect me in a negative way? Like, does this affect me? This doesn't affect me, right? It's not, a forever getting rid of things. It's just let's reset your body and determine like, what do you need, right? Waking you up to how foods may be affecting you. And it's about eating cautiously. It's not a perfection game, guys, right? It's a progression game and a consciousness game. And that should be the same thing that we're doing in pharmacy. So I'm going to go over really quickly because, this is not for you to all just be, oh, Arbonne. It's really about education. And as a pharmacist and as an Arbonne consultant, my passion is about education. But guys, hand to God on my son Cam's life, like these products are the best tasting shakes on the market. They don't have that chalky taste and they're not full of crap like a lot of things are. So as you can see, there's 20 grams of vegan protein, 22 minerals and vitamins, immune system boosters. We increase energy with it. It's free from artificial sweeteners and flavors and colors. It helps to build and maintain muscle. It levels out blood sugar, which is so amazing. It decreases sugar and carb cravings. It's made with yellow peas, brown rice, and cranberries. It has a complete amino acid profile. Guys, we know what all those things do and why they're so important. So this bag here, this is, I think, my vanilla one. It's 30 servings. This is 30 meals. people think trying to be healthier is really expensive, and you're going to see that with certain patients, right? But if you can get a bag and it's 30 servings, all you need to do is add water because it actually tastes good. This is going to save people money in the end, because I get that all the time. People are like, I can't buy organic, I can't buy non-GMO and things like that. And then they go into those center aisles. You know, the best place in a grocery store is the exterior. That's it. That's where most of your whole foods are, or the healthier options. Everything in the middle is all of the crap. And like, what you'll get is, you know, normally like you have this product and here's the real product right here, and then the rest is fillers and additives and, you know, inactive ingredients and crap like that that you don't need. So for our patients, we have a duty as pharmacists and as healthcare professionals to really help them and optimize their health versus just continuing to let them get sick. Okay. And that's why I do this. And I'm so passionate about this. So vegan protein, for anybody that recommends protein, whey protein is just not the best. Remember when we talked about certain foods that can cause inflammatory response or inflammation? That's whey. Whey can do that because it's a form of dairy. So dairy causes that. So therefore whey does. So it's causing excess work on your organs, you know, like, yeah, it's going to make you look all buffed up. Like, I pick up things, I put them down, but like, guys, that's not healthy. That's like boneheady, right? Has 22 vitamins and minerals. So remember how we talked earlier about with whole food, and even if you have your own garden, right? The agricultural process from the United States, like I think even like since like as early as the 1930s, that's like my grandparents' age. That's really when we started introducing poor agricultural technique, because we didn't have the land anymore because of mass growth and buildings and things like that. And if we're not allowing our soil to be replenished, then, you know, or we're adding pesticides, we're adding all this stuff, the food's going to get that too, right? You are what you eat, and what the food eats is what we are too, right? There's this crazy documentary and on like weightlifters and things all going a vegan diet. Now, I'm not a full vegan. I use vegan products, but I'm a carnivore as well, guys. I just choose to use like grass-fed and things like that. So I'm not a hypocrite. I'm just being honest with you guys. But they say, like, how are you as strong as an ox? And they say, do you ever see an ox eat anything but plants? So I can't remember what the name of the documentary is, but it's awesome. And if anybody wants it, I'll find it and send it to you. But this protein also has an immune system booster. We need immunity boosters in our bodies, right? Increased energy. Why? Because this stuff is so amazing. It helps like balance out cholesterol and all of that stuff. No artificial sweeteners, flavors, and colors. There are a lot of proteins out there that put artificial sweeteners and flavors into it. It's one of the reasons why Arbonne doesn't have a ton of flavors, because naturally it's very hard to get all those flavors. So, you know, that's why. It helps build and maintain muscle. So anybody who's looking to gain weight, this is not a weight loss product. It's a weight management product. So depending on how you utilize it, you could also gain weight if need be. So thinking about patients that can't really chew and only need, like, Ensure has so much crap in it. Like my grandparents, they have these shakes because I want them to be healthy and I want them to get their full amino acid spectrum. I want them to get vitamins and minerals, right? It levels out blood sugar. So for somebody who's passionate about diabetes, I love this product because it keeps blood sugars level. And guess what, as a pharmacist, when your blood sugars are level, you don't get hangry. Yay, right? So it's going to decrease those sugars and carb cravings because there's no artificial sugars in here that cause those cravings. And like I said, what it's made out of. So it's so awesome. The next thing are fizz sticks. These things give me life. They're the most amazing thing. Like I said earlier, I had sodas, I had Red Bulls, I had all the things. And now I have these little cute little fizz sticks that we can recycle with TerraCycle that I can just throw in my bag and just get some water, and that's all I need. So one, I'm saving money. But two, what's so amazing about this, it gives a calm energy, alertness, mental clarity. It has B vitamins, chromium, and ginseng. It replaces coffee, energy drinks, sodas. It reduces sugar and carb cravings, but it tastes so amazing. So we currently have citrus and pomegranate, and depending on when you're watching it, sometimes we have other flavors that come out and we break the internet. But guys, this stuff is amazing, and I haven't had any of those former drinks in years because of it. So detox tea, this has 9 detoxifying herbs, and it has milk thistle and all of these things. It acts as a natural diuretic, so but you're not like peeing like hydrochlorothiazide happens. It's a gentle daily detoxification to support your kidney and your liver function. It's mild, it's decaffeinated. It helps support weight loss and digestion because, again, it's helping the liver remove toxins. When the liver removes toxins, it usually pulls those toxins from adipose. And you can have a tizzy too if you want something warm, and that's mixing the fizz stick with the detox. It's so awesome. You can drink this up to twice a day if you want, but you just need it. It's so amazing, and I love it. Okay, the Digestion Plus, this thing is so awesome. With our skincare products, we also recommend this. It's hard to see, there we go. So what this bad boy is it is a pre and probiotic with digestive enzymes. Like, how crazy, because usually when you think of a probiotic, it's over the counter, and that's all it is. It's a triple threat. It increases immunity, it helps alkalinize and detoxify your body. Fizz sticks also help alkalinize your body. Sorry, I forgot to mention that. But it populates your gut with friendly bacteria and 11 enzymes. So this is awesome with anybody with the stomach issues, right? GERD, IBS, Crohn's. They have a lactose intolerance. If you're going to a different country for a while and you're not going to be used to the food, it's going to help, because, guys, you have to remember, there's an antibiotic resistance, right, in our country, and a lot of gut health. And it's not because we took the amoxicillin for 7 out of 10 days. It's because of the majority of our food, our chicken, our beef, had antibiotics pumped into it our whole lives, right? If you're around my age, that's just what happened. It's all of that coming out. So, we need that on a daily basis, not just when we, are having our antibiotics. So, okay, Fiber Boost. This is really awesome. It's made from fruits and vegetables, so it's not synthetic. It has 12 grams of fiber per scoop, and you can use as much, because with fiber, we know it's all different for everybody. It helps lower cholesterol naturally, like other fibers will do. It helps balance blood sugar, again, wonderful. And then you can put it to hot and cold. I put it in cooking. So I put it in food, like if I'm making mashed potatoes or burgers or things like that. And everybody usually just adds it to their protein, because the more fiber you have, the fuller you have, and you actually reduce your calorie intake. And a big thing with fiber over the counter, right? There's so many synthetics out there. Synthetic fiber should only be had for 7 to 14 days. I know in practice, patients are on it forever, right? Thinking about the elderly population inside of nursing homes, they are typically on a synthetic fiber every day, but there are now so many studies out there that show within children and adolescents with the elderly, when they're on synthetic fiber for long periods of time, it actually can cause mental distress and psychosis. Think about that, right? Think about when somebody, they send their grandparent into a nursing home, how many times do they say they're confused, right? They're still on probably the same meds that they were on, but they're getting added. And I'm not saying go to the nursing home and yell at them or anything like that, but just look to see if they're on fiber because they're not able to have regular bowel movements. There's something else going on, and the fiber is not going to help and heal. That's where that Digestion Plus comes. So things like that are just so crazy. Did we talk about the 7-day body cleanse? No. Deep cleansing. This attracts the toxins. I showed you guys that. Sorry. So it's powerful, mild. It's not a sea botanical anymore. This is an older slide, so I do apologize. But it's aloe and ginger. It's so amazing. I love it. It's gentle enough to use every day. During our program, we have you do this and incorporate it into everything that you're already doing during the week 3, because you pretty much have been doing the things to help get rid of toxins. This is going to kind of just add as that scrubbing bubbles and really help you with that plateau. Fit shoes are amazing. I have a few right here. They're the perfect little snack when you need something sweet. They're kind of like a Laffy Taffy or a Starburst, depending on the flavor. They're so ideal for an on-the-go. They're bite-sized. They help control blood sugar again and cravings. Again, we're controlling blood sugar. That's what's so important as pharmacists, to have our patients control their blood sugar. It's going to keep them from doing, the cravings that they shouldn't be doing. And it's so awesome. We have chocolate, caramel, and lemon right now. Lemon is my absolute favorite. It's so good. The Greens Balance, this thing is the bomb. I use this not just in my shakes. I do shots of this, but it's 37 detoxifying non-GMO phytonutrients. So phytonutrients from plants, right? And and it's whole foods that provide a symphony of antioxidants. So these are what we have in there. You have your greens, your reds, your yellows, blues. They're all combined. You can throw it in your shake. I put it in pasta sauces. I put it when I make burgers. And it's like the greatest thing if somebody does not like to eat veggies and fruits, because one, if you ate all of the fruits and veggies in here, you're gonna like to go crazy with your calorie intake, and your sugars are gonna go crazy up. But with this, because of the way they do it, because the science is super cool, it's only like 25 calories, and it's awesome. And it comes in this cute little jar, and we use it almost every single day. So I love it, and it helps with the immune system as well. Okay. So some favorite foods for cleansing, like you could do and add into these. So like lemons, beets, pineapples, asparagus, dandelion greens, the detox tea, all of these types of things are going to help naturally detoxify your kidney and your liver. We'll add digestive enzymes or adding healthy fat, all the good things that we need. So these are kind of the foods you want to look at. Obviously, some with certain medications. So as pharmacists and healthcare professionals, we want to, make sure we're doing good. And now we're coming to the end of this presentation. So I hope you guys have learned a little bit. Hope you like Arbonne from this as well. Like, I think it enhanced me as a pharmacist. It's enhanced me so much in my love of diabetes and helping these patients. So as you guys can see some pictures here, that is me. That is the picture of the trip that I decided I needed to make a change in my life. I was 35 at the time. I'm going to be 40 in April. So we're in February right now, 2020, depending on when you watch this. So this was in October or November of 2015. And then in January of 2016 is when I discovered Arbonne, discovered how to really use foods properly, discovered that the shampoos, the makeup, the body washes, all of the things I was putting on my body were actually doing something to my body. So that was all before that. And now, like, that is then, this is me right now. So I've been able to keep off that weight. I lost 17 pounds in my first 30-day challenge. And then I was able to take off 50 pounds. I had a child, so I have like a little bit of weight I need to like re-get off after having my son, but I also struggled for 5 years to get pregnant. So by removing these toxins and doing all the things, I contribute that totally to being able to be a mom to Cam. The next picture over here is my good friend, Erica. And she is somebody who had I think 2 of like the gastric bypass surgeries and things like that, and that like, shrinks your stomach so you can't really hold a lot, but she wasn't eating the foods that were the best for her. With the shakes, she can actually eat and be full, where before she'd only be able to eat, like it's a small amount at first, right? But she wasn't getting nutrients or anything like that, because it's really hard to absorb nutrients because you've cut out part of your system that absorbs the nutrients. So that's why she loves these products, and you can see she looks amazing. This is my friend Kristen on the left. I think it's on the left for you guys, and her husband Scott. Before they found Arbonne, he had triple bypass. Like, he had this crazy heart attack. They call it the widow's maker, because typically people don't survive from that. But guys, just look at their picture from their 20s to their 40s, and they're almost 50 now. They look amazing. I was just with her on a trip to Mexico that I earned with Arbonne, and like all these people who are just like so healthy and sharing their passion for this from every walks of life. They look amazing. This picture next, the before and after, this is my favorite. It's my mom. So it's a purple blue dress, whatever that is. That was when she had diabetes. And she was seeing a nutritionist the entire time, a diabetic nutritionist the entire time that she had diabetes. The picture to the right was after she had a health scare. I kidnapped her. I forced her to look at what she was using. And this is the end result, where now she is not diabetic. And it was 2, it wasn't 1. She is not diabetic. She is not on any blood pressure medication and not on cholesterol medication, and her levels are of a normal human being that's healthy. And it's so, so amazing, because as most of you guys know, if you know me personally, I lost my father when I was 19 when I was in pharmacy school. So it's coming up to 20 years now, and now my mom is healthier than she was even back then. So for me, this is not just a thing. This is literally changing the people that are closest to my life. This is my friend Sandy. Some of you guys may have known her. She's one of my like really great friends. And this was the, the picture on the left, it's a crazy transformation. It was a few years before Arbonne, but she definitely uses Arbonne all the time, and she became like a psycho when it comes to working out and things like that. She's such an inspiration, and she works out every single day and like has done marathons, and I'm so, so proud of her. And again, this is just another picture of my mom. Like, look at the face. Like, I don't remember my mom ever looking like that, but she totally did. She looked like that for years. And, as you can see, her smile is radiant now, and I love it. And she's able to run around and take care of Cameron, who's 2, and he's a lunatic. So she needs that energy. So the fizz definitely like helps her keep up with him. And then here's just my information for any of you amazing. If you have more questions or want more information on just Arbonne, here's my website, my email, alicia.deparalisa@gmail.com. I truly, truly thank you guys from the bottom of my heart for taking time to listen to this. I know it was a little bit long, but hopefully you got a little bit more information. And as healthcare providers, guys, we just have to start learning more. When you go into the healthcare field, you never stop learning. And what I truly love with this company is they never stop learning as well. And they just push the barriers of what is great for people to help them flourish and thrive with just the business opportunity, but also with our nutrition and our skincare products. So after this, go into your cabinets, right? Turn those things around and don't just look at the calorie counts. Look at those ingredients. If you can't pronounce them, like, it might be time to talk. Go into your makeup. If you're seeing those parabens, those mineral oils, any of the things on the banned 2000 list, have an extra question, right? Because you have one body and we don't get to redo it. Once it's done, it's done. And I love you all, and thank you so much, and have a great day. So thank you so much for watching this, and I hope you enjoyed. So I am going to try to, okay, here we go. All right, it's just me again. Okay, so thanks you again, guys, if you're still watching this. But truly, I hope you got some information about this. I hope you are becoming ignited and passionate about 30 days to healthy living and beyond, or at least just filled up your toolbox with a little bit more nuggets that you can help other people with. So God bless you guys, and have a wonderful, wonderful evening. Thank you so much.